Thank you, Mr. Chairman and Ranking Member, and thank you to our witnesses. I recently visited our southern border to see the conditions on the ground for myself, and what I found was a crisis spiraling out of control. As a physician, I focus my time looking at the care given and the public health conditions, as well as the threats to U.S. health posed by the failure of this administration to act. And I'd like to share what I thought were three startling observations related to COVID. First, the mass exodus of people after Biden canceled the asylum agreements has filled facilities to grotesque levels. In one pod built for 33, I saw 621 young girls crammed into that space, stacked nearly on top of one another. They can't test for COVID, so it only occasionally happens when they're turned over to the NGOs. And in that rate, or in that group, the positivity rate is 10%. And that means thousands and thousands of COVID positive immigrants are being released into the U.S. monthly. Churches in several states still can't fully open, but the left seems completely fine with COVID incubators blasting positive patients into our population. If this committee fails to address this committee has no credibility whatsoever. Secondly, there is no vaccination assessments going on at all, with many indigenous peoples coming through the border from Northern Triangle countries where vaccination for things as rudimentary as measles is not confirmed. Americans are at risk for another massive health crisis. This administration's failure to ensure the American people are protected from this threat is an egregious violation of their oaths. Third, COVID variants. Right now, the U.S. doesn't have a huge problem with mutated variants of the COVID virus. There are some present. It's not a huge problem. While I was on the border, I met with family after family coming from Brazil. Brazil has a particularly nasty variant, and again, with no screening, we simply have no idea how much of the positive patients are bringing COVID variants into our country. What are the members of this select committee on the opposite side of the aisle got to say about that? Crickets. There are a few more points that I want to make about public health in regards to this horrendous crisis caused by the Biden administration's failure. First, illicit drugs kill tens of thousands of Americans every year. Much of the heroin and fentanyl coming into the United States crosses our southern border. And while what we are able to catch comes through checkpoints for the most part, the volume bypassing those checkpoints during this crisis has skyrocketed. What they've seized since the president's executive orders opened our border has been an 800% increase. While we were there, multiple splash and grabs happened. That's where the cartels just drive a dope-filled car into the river, and the mules on our side go across with rafts and grab the drugs. Pounds of fentanyl was seized, not by Border Patrol agents, but by Texas state guardsmen. But they're not enough, and we know drugs, gang members, and guns are bypassing agents consumed with handling the mass sea of humanity pouring in. The agents are so overwhelmed, the actual screenings to determine if a migrant is a drug trafficker are no longer done by law enforcement. We're paying NGOs to do it. Americans will suffer because of these criminals, and Biden sits quietly by letting it happen. This is a gross dereliction of duty. And again, Americans will suffer because of his and Vice President Harris's failures. One last point. Currently, there is no DNA testing of those claiming to be families. We know how the cartels work. The Guatemalan ambassador told me they seize children, carry them across the border as a ticket into the United States. In some cases, when they get across the border, they just dump the children. It's hard to believe, except there's video after video showing it happening. Cartel members are claiming children and simply walking into the U.S. as fraudulent families. Essentially, by not testing these people, we're encouraging human trafficking. Think about that. The Biden administration is facilitating human trafficking. Again, this is an egregious failure because they know it's happening and yet they do nothing. It's appalling. This is what we get with an open border. Americans are being infected with a deadly virus, potentially other pathogens. Coronavirus variants are pouring into the U.S. More Americans will die from drug overdose, and more children and women are being trafficked and raped. And Biden and Harris sit in D.C. with no plans to visit the border and no solutions to offer. Anyone who attempts to cover this up by deflecting to BS accusations that this is Trump's fault are complicit in these crimes. With a nauseated stomach at this point, by the failures of our president, I yield.
I thank the gentleman from the Eagle and back from that tirade.